Hi guys, my name is Madison. Welcome back to my channel. Today I'm going to be specifically talking about my experience getting a lumpectomy and then the results of that, and also talking about my personal decision not to do chemotherapy. And I still don't have equipment to film anything fancy and like upload it and edit it. So I'm just filming one video and I'm gonna pop it up on YouTube. So let's get started. So I got a lumpectomy on September 29th of 2020, and my surgery was supposed to be an outpatient surgery, barring anything going majorly wrong. I was supposed to go in during the day, leave that same day, go home, recover, nothing too fancy or extreme. My case did not go that way, but it was not because anything went wrong with surgery. According to my surgeons, my surgery went perfectly fine, perfectly well. I just have really bad anxiety and I'm really prone to panic attacks, and I was really freaking out about the surgery. So my heart rate was very high before surgery and then also while I was in surgery. And my doctors were pretty concerned and didn't really feel comfortable, I guess, letting me leave without me seeing a cardiologist. And by the time I was done with my lumpectomy, cardiologist had gone home. They were like, well, we're gonna keep you overnight, watch you. Once I got back to another room and had eaten some, I felt completely fine and normal and, went home the next day, no issue. But all of this to say, usually lumpectomies are outpatient, but sometimes things can happen and you may or may not stay overnight for monitoring and stuff like that. As far as the actual procedure of a lumpectomy goes, mine was done with just one incision. It was actually made just right here. You can kind of see the scar. I only had to have one incision. Some people have to have two. It just kind of depends on how large your tumor is that you're getting removed. Mine, they were just able to get everything with the one. I had my tumor removed. My tumor was 11 millimeters, so 1.1 centimeters big. And then I also had 5 lymph nodes removed. So leading up to the lumpectomy the day before, I had a injection that sent blue dye into my lymph nodes that feed just like right into that area of my breast. And this is what helps the surgeon locate your sentinel lymph nodes, which means, just the ones that drain into your breast, like the most immediate ones. The dye helps them locate those. So during surgery, you also have blue dye injected like into your breast. So if you have a lumpectomy, you'll be peeing blue afterwards. Even other body fluids or things coming out of you can be blue, forewarning. But so basically you get this dye injected into you, and you go get an x-ray or a CT scan, I forget which one, maybe an x-ray, and they see the dye, they say, okay, it's good, it's doing its job. If it is, then you're free to go. If it's not, you might have to get a second injection. Feels like a bee sting. It was kind of painful. Nothing that squeezing the nurse's hand didn't really, help, but it was uncomfortable. It was painful, but it's over. And then after that, hopefully it drains properly and it's the only one. Some people actually get this the day of their surgery. I had mine the day before. I think it just depends on where you go. I also was apparently supposed to have this next procedure done the day before, but our scheduling at MD Anderson got mixed up and I wound up having this done the morning of my surgery. But you may or may not also have what is called a magnetic seed placement. So basically, I think this is like new technology, but my breast surgeon had it to where I had a magnetic seed placed on my tumor. So that way, whenever they go in for surgery, they have a tool and it just like is magnetized and goes straight to where the seed is. So there's the tumor. It's like a biopsy, I would say. If you have the biopsy done, it's kind of similar to that, but not really. It's not as intense and not as painful and long. You just get the numbing agent, the lidocaine, and then they use, I don't know, I wasn't looking, but they use some kind of tool to put the magnetic seed into you. It's not large. It's not painful because you can't feel anything. But mine was placed the morning of, and then I went over and I had surgery. They made the one incision, they located the seed with the magnet thing, they took out the tumor, they took out my lymph nodes, and they took those and did testing on those. And they found in my case that I had micrometastatic disease, which just means that in one of the lymph nodes, they found 2 tiny cancer cells, the biggest one being 0.4 millimeters. The other one, they didn't even give me a size. It was just so tiny. But what this tells them is that my cancer kind of spread outside of my breast a little bit, but there was no evidence in the lymph node where they found the cancer that it had traveled outside of the lymph node, which they could tell by looking at the fatty tissue surrounding the lymph node that came out also with the lymph node. So this is kind of cause for concern usually, because it means that obviously the breast cancer has not only been in your breast, but in my case, it was very, very tiny. It was in 1 out of the 5. And sometimes people, when they have lumpectomies, if they find enough evidence of there being disease in your lymph nodes, they may go back in and take more lymph nodes out. Also, if you don't get something called clear margins with your lumpectomy, meaning that whenever they take the tumor out, they test and make sure that the tissue surrounding it doesn't have any cancer cells. If this is all clear, when they take it out, there's no more cancer, you're good to go. You had the one lumpectomy, one and done. If they do find that there's still cancer around it, this means, I think it's called positive margins, but basically you have to go back and get kind of a second lumpectomy where they take more out because they did not get everything the first time. This is common. If this happens to you, I know personally people that this happened to. It's not, doesn't mean they did a bad job or that anything went wrong. It's just that they didn't get everything the first time, so they have to go back in and take some more out. I was fortunate enough that I had the one lumpectomy and then I was done. As far as healing goes, my scar, I don't know if you can tell, I mean, it's healing pretty nicely. It's not very noticeable. Right after surgery, they had me with some like gauze. I don't think there's any kind of bandage or anything, but they give you a front closure surgical bra that you'll have to wear for quite a long time. No underwire bras, only supportive, soft, like easy to put on bras. I would definitely suggest front closure though, because you're not going to be able to have the range of motion to like do anything in the back. And you also can't like lift your arms up to like pull anything over. So front closure bras and front closure soft cotton t-shirts for recovery in bed is definitely needed. If your loved ones are asking, what can I get you? What can I get you? Get front closure pajama shirts and also certain types of pillows. I used a wedge pillow that I put in my bed, and it was just literally like, you know, a triangular wedge pillow that kept me sleeping at an incline because I hate sleeping on my back. I cannot sleep on my back, and I was really worried about not being able to sleep after surgery. And so this wedge pillow it forced me to sleep on my back, but it also kept me at an incline to where it was easier to sit up and do things. I also had a little stuffed animal that I kept like under my arm and like in between, so that way like my arm wasn't bumping the surgical site. What else? I also would definitely recommend something for when you're coming home from the surgery, a pillow to put like in between you and your seatbelt. People don't really think about that, but definitely having something to cushion the seatbelt is definitely needed because you're going to be sore. It's going to be painful. I took pain medication that they gave me at the hospital, but I only took it, I want to say, like the really heavy pain medication for like 1 to 2 days. If you need to take it for longer, do not feel bad. It's a surgery, you know, it's painful. But you will, after you kind of get off the harder pain medications, you'll probably do what I did, which is rotate just like Tylenol and ibuprofen. Get up and walk every day. As soon as you are like out of surgery, like that next day, get up and walk, even if it's just like a few steps, and then you go back to bed. Walking definitely helps keep your body like like working, so that way, one, you don't catch any kind of like pneumonia or anything, but also just so you are recovering faster. Like it really does help, and you will see it really only took me maybe 4 or 5 days, and I was like walking like normal distances again. Not anything crazy, but like I wasn't winded after going like, 500 feet or whatever it was. I'm terrible at distance, so, but walking is great. What else about recovery? It's just kind of recovering like any other surgery, I would say, with some caveats like needing supportive pillows, maybe a wedge pillow. Some people really like recliners. I don't know if that's necessarily needed for just a lumpectomy. If you get a mastectomy or a double mastectomy, maybe you might want to look into a recliner, especially if it's going to be like a longer recovery time. I would say total for me, recovery before I was kind of like walking around normally and functioning normally again might have been 2-ish weeks, 2 to 3. Make sure you do your stretches that they tell you immediately and do them multiple times a day, because range of motion is super important. I was like trying to like put my hair up in a bun and with my like T-Rex arm, like I couldn't really move it, and doing the stretches definitely helped a lot. Make sure you keep the surgical site clean. This is all stuff that your surgeon will tell you, but it's just really important to especially follow walking, stretching, eating right, getting enough sleep, taking your pain medication on time, and giving yourself grace when you're healing and getting back into your normal routine. As far as reconstruction goes, I was lucky that I didn't need reconstruction. My plastic surgeon, who was in surgery with my breast surgeon, walked in, after and told me like, we didn't do anything. We didn't need to do anything. You're fine. But that's not the case for some women. If your tumor is larger, they might take a larger, piece of like your breast out, like more tissue. So you might have like an indent or some kind of like concave part there now where the tumor was. So a lot of times what they can do is they can take from your other breast and like move some fat over, or just basically make it look symmetrical. This is something that you would talk to a plastic surgeon about, or a reconstruction surgeon about, because it just completely depends on the size of your breast, on how big the tumor is, on how they need to go about like removing it. It's really, the plastic surgery and reconstruction side is just to make sure that you are happy with the outcome after the lumpectomy, and that your breasts are symmetrical and like to your liking. Again, me personally, I have pretty like average to like smaller breasts, and my tumor was very small, and I think it was just in a spot where luckily there wasn't any kind of huge divot or anything noticeable. So that's just my experience. As far as what they found after surgery and my decision to not do chemo, I already told you that when they took out the lymph nodes, took out 5, one of them had micrometastatic disease. The other 4 were fine, but they also, when they took my tumor out, they sent it to a lab and they gave it a score, an oncotype score. And this is looking at the genetic markers of the tumor specifically. This is not like your genes, like when you get tested for BRCA or these other gene tests. This is specifically on my tumor that was in my breast, and what the oncotype score gives them an idea of what my chance of recurrence is. So I got a score of 14, which basically means I have like a 14% chance of having recurrence. The iffy part about oncotype scores in my case is that these are all the data we have on how to proceed with chemo. It's all based on a population where I am an extreme outlier. Even women who are 30 and 40 have a different protocol than women who are 50 or 60. So imagine 22 versus like 30s and 40s. I mean, it's just like, it's not really comparable. So usually if you're like 50 or 60 and above, a 14 oncotype score, they probably wouldn't even suggest chemo. All depends on like other factors, but usually would not suggest chemo. If it comes down to the decision being based on the oncotype score, 50 and 60, really low score. 30s, 40s, average, depends on other factors, may or may not recommend chemotherapy. For me, since I'm, again, an extreme outlier, they said that they recommended chemo because with my age, I just simply have a greater chance of recurrence because theoretically I should live a lot longer. So I have a lot more time to experience a recurrence, and I'm really lucky. My team came at this with the idea of, we don't want you to ever have to worry about this again. We want to get it out. We want you to be done with it. Like, you know, and so my score was 14, which is in the gray area for most people, but for me, still in the gray area, but there were other factors, mostly my age, that made them sit me down and have like a real conversation. I took like at least 2 weeks, if not a month, to come to this decision, but I ultimately decided that I did not want to do the chemotherapy. And that was because kind of like the reason that they wanted me to do the chemo is the reason I didn't want to do the chemo. I have theoretically a lot longer to live, and I personally didn't feel like a 14% chance was enough to make me feel like I was in such an imminent danger that I was willing to give up my energy and like my like relatively good health for the really awful side effects that can come from chemo. Not everyone experiences all the side effects, but I mean, it wasn't just about losing my hair or about, you know, vomiting or having these other really awful side effects, but like, you know, temporary. It was more so about the feeling of fatigue that many people told me is going to stay with me for probably the remainder of my life. The feeling of like, you know, bone density loss and like just these changes that would have happened to my body that I would have had no control over. And also the very, very tiny chance, but still possibility that I could get some kind of secondary cancer from it. Again, very, very, very small, like 1% of people this happens to. But it just felt to me like something that at the time, if I'm being completely honest, I didn't even feel like I could do it. And I felt really cowardly about that. I felt like I had seen all of these beautiful, strong, amazing women just like getting through chemo and sticking with it and just kind of, you know, doing it. And I was like, I told my doctor, I really don't know if I could ever physically and emotionally come back from going through that right now with everything else going on in my life. I really didn't feel comfortable doing it. And my doctor did inform me that my specific hormone therapy, the Zoladex shots with the exemestane, the aromatase inhibitor, would knock my chances down like a significant amount. And if I did that, then, you know, she would be comfortable. And they always told me it was all up to me. It was my decision, which I was so grateful for. They said that they would support me no matter what I chose, which I don't know if that's everyone's experience, but I was really, really lucky that that was my experience. And basically, I said, you know what, I'm going to do the radiation, I'm going to do hormone therapy, and if it comes back, that's on me. And they were also very adamant about telling me, like, they were just concerned that I might regret it later on. And that was something I had to sit with for a really long time, was genuinely asking myself, if I have a recurrence in so many years, 9, 10, even 20 or 30 years, like, will I regret not doing chemo? And the answer was just always no. I could have a recurrence, and I can tell you right now, I would not regret not doing chemo. I'll do chemo if it comes down to it, and I get a recurrence. Of course I'll do chemo. I'll do whatever it takes. But this time, they could only guarantee me this chance of recurrence for the next 9 years. Hopefully I have a lot longer than 9 years. And if that's only for 9 years and there's no evidence that it had gone outside of my lymph nodes, I mean, it was just so many factors. But it mostly came down to, could I go to sleep at night knowing that I didn't do chemo and still feel like I had done enough to protect myself and my health? And did I do everything that I could handle to fight this cancer? And the answer is yes. I think that I did. I think that I made the decision that was right for me at the time. I have no regrets. Maybe I could have done it. I probably could have done it. And that was another thing. I wanted to make sure that I wasn't not doing it because I was scared of it. I when I came to the realization that I could do chemo and I could get through it, and it might suck and it might alter my life forever, but overall I would be fine and I would live my life. Once I realized that that didn't scare me, I knew that I didn't want to do it. And that was just how I felt. And that's what I told everyone kind of from the beginning, was that I can't imagine myself doing chemo. It doesn't feel like it's something that I want. I would rather have a shorter life that has better quality than a longer life that maybe I push off the cancer for however many years. You know, and maybe I could die 2 weeks from now in a car accident and the chemo would have meant nothing. I mean, I don't know. It just felt very like I was gambling, which cancer just kind of feels like you're gambling anyways. But, you know, I really believed that chemo was not right for me, and I don't regret not doing it. Disclaimer though, all of this to say, this is just me, and I have so much respect for every single person who's gone through chemo, whether you had breast cancer or any kind of cancer. Like, you amaze me with your strength. You are stronger than you know, and I'm in awe of everyone who's gone through it and made it out on the other side. And some people, it's really not a big deal. And there are so many people who are so ready and excited and want chemo so badly because they really feel like it's killing these cancer cells that could be in your body. But for me, knowing that it would only take that one rogue cell that may or may not be in my body and trying to hopefully kill it with chemo, knowing that it would decrease my quality of life and I would really truly be saying goodbye kind of to my 20s and how I wanted to live them and the health I wanted to be in for my 20s, just it wasn't worth it for me. And that is only me. And I may be the only person in the world who feels like this. And there are, I'm sure, plenty of people who are looking at me and watching this video thinking I'm crazy. So I'm not going to defend my choice outside of this. I've kind of stated, I think, most, if not all, of how I was feeling, minus the other circumstances going on in my life that really made me feel like there was no possible way that I could do chemo and not come out of it completely just broken as a person. But I'm happy with my decision. And I hope that this video gave you some insight onto what a lumpectomy is like and what the healing process is like. And then also, if you have to go through the terror of getting an Oncotype score and waiting for results and then having to make decisions about chemo, I hope that I maybe enlightened you at least into my thought process. I would be happy to share anything else that I did not cover, but other than that, since I can't really stop the video and like edit this long pause out because I'm just going to upload this exact video, other than that, I think that was it. Yeah. I will upload a video soon talking about radiation and hormone therapy, and then I hope to start doing some videos on like things to buy someone when they have surgery and things that I learned through my process, and the importance of support groups and just mental health during cancer, because oh God, what a roller coaster. I'm doing okay now, but let me say, if it hasn't come across in like my other video and this one, which it might not because like I'm in a relatively good space right now, I will say that this is new. Cancer is very, very difficult, and there's a lot that goes on. If you're going through this and you're feeling completely broken and shattered and hopeless, I was in your shoes literally a couple weeks ago. It's really hard, and I hope that these can hopefully provide some kind of comfort, because it's not easy and it really sucks. Cancer sucks. Recovering from cancer sucks. Active treatment sucks, but you can get through it. You are strong. There are people who are here to support you who have walked similar paths. And I saw a quote, I just got chills thinking about it, but there was a quote a friend of mine had shared, and I don't remember it exactly, but basically it was talking about how people walk through hell and they walk out carrying buckets of water for anyone else. And like, I hope you know, I want to be your bucket of water. I'm here to dispel any knowledge, any experiences that might help you understand something better. I'm not a doctor, clearly. I'm just a 22-year-old girl who got diagnosed with breast cancer out of nowhere and is navigating it as best as she can. And I would love to help you in any way that I can. So please subscribe, comment, any questions, follow me on my social media accounts. They're down below. If I missed anything, just let me know. But other than that, don't feel like you're alone. It's going to get better somehow, some ways. Maybe not how you're expecting it, but you're strong and I believe in you and I know that you can get through this. So I hope to see you in my next video, and thank you so much for watching. Yeah, I'll see you later. Bye.